Good morning. I am your student nurse for today, and in this video, I will be performing newborn sanctioning. First is to identify the patient and determine the need for sanctioning, verify the sanction order in the patient's chart if necessary, explain what you are going to do and the reason to the significant other, even if the patient does not appear to be alert, and perform hand hygiene. Adjust the bassinet to comfortable working position if patient is conscious. Place him or her in a semi-Fowler's position, and if patient is unconscious, place him or her in a lateral position facing you. Move the bassinet close to your work area and raise to waist height. Place a towel or waterproof pads across patient's chest. Adjust suction to appropriate pressure for a wall unit 60 to 80 mmHg and for a portable unit 6 to 8 cmHg. Put on disposable, clean gloves and occlude the end of the connecting tubing to check suction pressure. Place the connecting tubing in a convenient location. Open a sterile suction package using aseptic technique. The open wrapper or container becomes a sterile field to hold other supplies. Carefully remove the sterile container, touching only the outside surface. Set it up on the work surface and pour a sterile saline into it. Place a small water-soluble lubricant into the sterile field, taking care to avoid touching the sterile field with the lubricant package. Increase the patient's supplemental oxygen per facility policy or physician's order. Put on a face shield or goggle mask. Put on sterile gloves. The dominant hand will manipulate the catheter and must remain sterile. The non-dominant hand is considered clean rather than sterile and will control the suction valve Y port on the catheter. With dominant glove hand, pick up sterile catheter, pick up the connecting tubing with the non-dominant hand and connect the tubing and suction catheter. Moisten the catheter by dripping it into the container of sterile saline. Occlude Y tube to check suction. Apply lubricant to the first 2 to 3 of the catheter using the lubricant that was placed on the sterile field. Remove the oxygen delivery device if appropriate and do not apply suction as the catheter is inserted. Hold the catheter between your thumb and forefinger. For nasopharyngeal suctioning, gently insert catheter through the nares and along the floor of the nostril toward trachea. Roll the catheter between your fingers to help advance it. Advance the catheter approximately to reach the pharynx. For oropharyngeal suctioning, insert catheter through the mouth along the side of the mouth toward trachea. Advance the catheter to reach the pharynx. Apply suction by intermittently occluding the Y port on the catheter with the thumb of your non-dominant hand and gently rotate the catheter as it is being withdrawn. Do not suction for more than 10 to 15 seconds at a time. Replace the oxygen delivery device using your non-dominant hand. Flush catheter with saline, assess effectiveness of the suctioning, and repeat as needed and according to the patient's tolerance. Wrap the suction catheter around your dominant hands between attempts. Allow at least a 30-second to 1-minute interval if additional suctioning is needed. No more than 3 suction passes should be made per suctioning episode. Alternate the nares unless contraindicated. If repeated suctioning is required, do not force catheter through the nares. Suction the oropharynx after suctioning the nasopharynx. When suctioning is completed, remove gloves from dominant hand over the coiled catheter, pulling it off inside out. Remove glove from the non-dominant hand and dispose of gloves, catheter, and container with solution in the appropriate receptacle. Remove face shield or goggles and mask. Perform hand hygiene. Turn off suction. Remove supplemental oxygen placed for suctioning if appropriate, and assist the patient to a comfortable position. Do oral hygiene to the patient after suctioning. Reassess patient's respiratory status, including respiratory rate, effort, oxygen saturation, and lung sounds. Document the procedure to the patient's chart. Thank you. That's all. God bless.